It's a common saying that nobody ever died from pain. It's just not true. Chronic, useless pain can cause very severe psychological and physical effects to our bodies and to our brains. It causes sleep deprivation, depression, even dementia. Physically, it can cause metabolic problems, chronic stress, obesity, even heart attacks. If we suffer from other chronic diseases like diabetes that need our attention, it can distract us from caring for ourselves as best we can by pushing almost everything else off the table. Now, a wide range of treatments have been tried. The drugs that are used have problematic side effects ranging from stomach upset with non-steroidal anti-inflammatory drugs like ibuprofen to addiction when we use opioids. They've become a scourge on humanity. And remember how drugs get to work in the first place, through blood flow. And if the blood flow of the area is constricted as we have described, then they won't work anyway. Psychotherapy, such as cognitive behavioral therapy, can also be tried, where you can learn techniques to think away your pain. And these work for some people, but not for all. Surgery is often very invasive, changing your body in ways that are irreversible and often not solving the problem at all, as it may be addressing the wrong problem in the first place. So for many people, the best solution is to settle into your body, feel out your chronic pain, then address the problem precisely at the level where it's being caused with PerryWork, and then work with your massage therapist, your physical therapist, or your chiropractor to make the changes to ensure that it never comes back. PerryWork treats over 30 chronic pain conditions. You can find those on our website, perrywork.com, and has proven to be one of the most effective solutions for chronic pain. We've treated over 20,000 patients over the last 30 years. Thank you. So, what's happening at that landmark point? Underneath the skin, there are 4 more layers of tissue. Your dermis layer, your fat layer, your fascia, and your muscle layer, making something like a 5-layer cake with your skin. For some reason, these layers can get bound up together during healing from an injury or other cause of chronic pain. They seem to form tight bands of tissue, sometimes called adhesions, involving all 5 layers. You can feel these bands at each landmark point for yourself. They're what make you want to roll on a tennis ball if you have a pain in your shoulder or back, or use a foam roller. After injury has healed, this band can remain because of the inflammatory response, originally to your injury. You see, when healthy tissue is injured, the body sets up an inflammatory response around the area. That's what creates the swelling and the heat around the injured area. It's new blood flowing in to solve the problem. But this inflammatory response can go too far by releasing a lot of acidic body fluids around the area affected. These acidic fluids can reduce blood flow to the area, the opposite of what was intended, by cutting off blood vessels. Experiments have shown that inflamed areas become more acidic than the rest of the body, at least briefly, and blood perfusion can actually be reduced. Now, if this happens, the fresh blood that would normally clear away the problem can't get into the area. The area begins to literally wall itself up, bringing together the tissues into those bands, which in turn further compress the blood vessels and squeeze the sensory and motor nerves in the area. That's what causes the sensory nerves to keep firing that pain signal, strengthening the nerve signals on those pathways to your brain. In your 43 involved brain centers, your cognitive centers register an ouch feeling. More worryingly, your emotional centers register what we call the yuck feeling of chronic pain. All of this is bad pain because it serves no useful function. It's a disease. It's essential to break this cycle before it becomes automatic. In the next video, we will show you how PerryWork does just that.